Intelligence AI really going to replace my doctor someday? Well, I don't know about any day soon, but it could be that down the road you're going to see more and more influence from AI in helping your doctor make decisions, and also treatment, and also monitoring. It's got so many applications. I'm going to go through and talk about 4 of these applications in healthcare, and trust me, AI is revolutionizing the healthcare industry, and that's going to, I think, drive costs down. That's a beautiful thing, right? So the role right now of AI in healthcare just keeps skyrocketing. They're finding more and more uses for it. But I think what I'm intrigued about is 4 of these topic areas, and I'm going to go through this and cover each one a little bit. But for the depth of this, you need to go to my blog, RxHealthyHabits.com. It's all in there. And it can go really in some detail about each one of these topics. It's fantastic. So, number 1, AI-powered diagnosis. Faster and more accurate diagnosis are going to take place with the AI tool for the doctor to reference to. And we're talking about some speeds that sometimes it can be incredible to get to the answer that what possibly is wrong with this patient, and sometimes definitively with the data that it has and how fast it crunches it. But AI-powered diagnosis, huge. Radiology is already using it. They're looking at AI algorithms to help you really identify early signs of diseases, cancers, fractures, all that. So radiology is using it. Pathology. This is helping them really understand tissue samples, and only speeds up the diagnosis and treatment of some of these tumors and the pathology, and it really takes away a lot of the human error that can take place, which is interesting. Predictive analytics. So we can take complications based on the patient's data, lifestyle, genetic information, and enables the healthcare to really predict how to proactively take care of this patient, but also reduce emergency and hospitalizations. That's huge. So we can actually kind of prevent some things from coming to a head because of predictive analysis with AI. Chronic disease management, without a doubt. Analyzing data, providing recommendations, early detection of chronic conditions, all possible. Readmission prevention, this is huge. They can tell by dumping in some data, and AI can crunch it and also look at some factors. It can actually tell you that there might be a higher risk of this patient coming back for readmission to the hospital unless some intervention is made. And this really is going to help reduce costs. I'm excited about that one. How about number 2? This is big. Personalized treatment plans. Finally, now we can tailor medication regimens to the patient's genetics, medical history. We can look at other data, and we can tailor that now exactly to the patient to minimize side effects and essentially increase efficacy. Huge. Pharmacogenetics has been a field of study for years, but now it's really coming to a maturity, because with this tool they can really dig in and get the right medication at the right dose, and sometimes the right dosing makes a big difference. So, well, in many cases, but in some disease states and some treatment regimens, it's critical. So, drug discovery, they're finding that right now the AI can analyze vast data sets and get potential drug candidates that they can believe would be, AI is going to sort that out and say this would be a good candidate for this particular treatment, and this drug could be something they can bring to the forefront much faster. That's huge. Treatment recommendations all the time. This is done right now, based on the information they take in from the patient. But it also can come up with recommendations, treatment options. This is going to take place based on the patient preferences, side effects, maybe other factors. So the treatment options, and one I like as a pharmacist is drug interactions. Much better now at managing these and really putting in the data and really looking at the thing and really distilling down what's really important, what's not when it comes to drug interactions, with many more factors being taken into account. Hope that makes sense. Remote monitoring and telemedicine. This is number 3, and it's huge because now with the technology available, there's just one example, we can do continuous data collection, monitoring, and this is really kind of what they call the whole remote patient monitoring thing that we didn't really have before. We had some semblance of this with, pumps and all that with your cell phone. This is much more advanced, and this continued data collection is going to lead to some early intervention, because your provider's going to be able to see things coming, right? Telemedicine, we're all familiar with this. A lot of times the cost on that's come down a lot. Actually, sometimes zero copay. You really go online and you type everything in, and then I'm sure they take some pictures. I mean, I had this done before of whatever, I was trying to say it was my malady, and they'd come back with an answer, and it was also, I'm sure, reviewed by a doctor or some type of health professional. that was trained in diagnosis, but he or she had all this data, and it really predicts down what you need to treat with, whether it be, the pharmaceutical treatment, for the medication choice regimen, some things to do to help get that disease state or that acute disease state under control. In my case, it was a STI. I know some of the treatments of that already, but I was kind of intrigued about how they were ruling out things with the questions. And then they were looking at, do you have a history? And that was significant. So all I'm saying is it's really kind of great for telemedicine. And these virtual consultations are great. The diagnostics, beyond measure when they have all that information, especially someday when we get all your patient history with all of your medical records. It'll search through all that. That's huge, right? So I'm really a big believer in the fact that I think it's going to revolutionize a lot of do-it-yourself healthcare for primary conditions, primary acute conditions that you could treat. Next thing, this is number 4, surgical assistance. So yeah, you got this robotic that's going to be doing some work, especially when it comes to minimally invasive surgeries. And it's already happening. You heard about this, robotics in surgery, but now with AI, it's going to become even more advanced. And what they're saying is the precision is going to be incredible, the enhanced visualization, so many things. But also one thing that's kind of neat is intraoperative decision support. So while the surgeon is doing surgery, there can be some data that's being crunched, especially about tumor detection. Maybe it's blood flow monitoring when they're doing some things that require tissue oxidation and the blood flow's got to be correct. All that can be done with AI really as part of the tool that the doctor's using during surgery. So, I don't know. I'm really jazzed about it. I think it's going to revolutionize healthcare. And like I said, I think it's going to drive down costs. And I think you're going to find that down the road, you're going to have a lot more choices because of artificial intelligence in the healthcare field. So, until next video podcast, stay healthy, stay strong, and be open to maybe someday a robot being your doctor, or at least helping your doctor. Maybe, how about this? It'll be your doctor assistant. All right? Okay. Take care. God bless.